Hey everyone, my name is Andy. I am a women's health nurse practitioner that's currently in the postmaster's program to add a psych mental health component. I just wanted to thank my wonderful group, Morgan, Argentina, Phyllis, Roshni, and Brad. You all did a wonderful job collaborating, and we are so happy to present to you our Grand Rounds presentation, where we focus on the topic of staffing and its cascade effect on communication, quality of care, and patient satisfaction. Our objectives are to identify challenges of staffing, recognize effects of staffing on communication and quality of care, and implementation of staffing solutions. This video is a piece of a longer discussion by the American Association of Critical Care Nurses regarding the need for what they describe as a long-term collaborative effort to change the staffing paradigm in our country to one that values nurse staffing as an investment in patient safety and better outcomes rather than as an expense.
I know not every staffing solution will work for every unit or every hospital. If anything, we've battled too long with those one-size-fits-all solutions. That's why it's important for us, the people that work in hospitals and in units, to use our voice and our strength to create the staffing models that work best for us. We also know we can't solve this issue alone. That's why we're partnering with other nursing and national organizations. The IHI, National Patient Safety Foundation, the ANA, AONL, and the Healthcare Finance Management Association. Yes, we have the finance executives at the table. And you know what? They're really pretty cool. They get it. These other organizations represent key pieces of the equation if we are going to identify solutions to the issue of appropriate staffing. Over the past year, we've spent time with these leaders, and they all agree. It is time to shift the conversation from nursing as a hospital expense to nursing as an investment. This really gives me such great hope that the future will be different. We all want to find a better solution for staffing so we can make our optimal contribution. And AACN is committed to using our collective voice and strength to see this through. Of course, this is a complex issue and it will take time. But rest assured, we are committed to advancing this crucial work as our advocacy priority.
The nurse staffing ratio is the number of patients a nurse is assigned to during his or her shift. The ratio is based on the patient's acuity level as well as how competent the nurse is. When nurses have fewer patients, they can provide more direct patient care, patient education, family education, and decrease the risk of medication errors and adverse patient outcomes. Georgia currently does not have a nurse union, but nurses can be part of the Georgia Nurse Association and help improve laws that can help protect nurses against workplace violence, harassment, burnout, and the high patient-to-nurse ratios. In many hospital settings, as well as nursing homes, nurse-to-patient ratio is based on what the facility thinks is appropriate. While the important thing to look at is the acuity level of each patient and the competency of the nurse caring for that patient, what we have seen happening, aside from COVID-19, is that nurses are to accept increased patient ratio regardless of the acuity. This leads to error in medication, adverse patient outcomes, and high turnover. The increased patient ratio also affects nurses feeling mentally and emotionally exhausted and burnout. To make the change in nurse-to-patient ratio, new nurses as well as experienced nurses should become part of the Georgia Nurse Association to help create a law that hospitals and other facilities are enforced to follow. The ANA has provided 5 principles for nurse staffing. Principle number 1, healthcare consumer. Nurse staffing decisions are based on the number and needs of the patients, families, groups, communities, and population served. Principle number 2, interprofessional teams. Optimal care is achieved through individual actions and collaboration with other healthcare team members. Nurses are full partners in the delivery of safe, quality healthcare. Principle number 3, workplace culture. Organizational leaders must create a workplace environment that values nurses as critical members of the healthcare team. Principle number 4, practice environment. All nursing care delivery systems must provide the necessary resources to meet each healthcare consumer's individual needs and the demands of the unit. Principle number 5, evaluation. Organizations must have appropriate nurse staffing plans. All settings need well-developed staffing guidelines with measurable, nurse-sensitive outcomes. In 2017, H.R. 2392 and S. 1063 were introduced in Congress requiring hospitals to submit their actual staffing plan and patient-to-nurse ratio per department. However, these bills did not gain much attention during congressional hearing. The National Nursing Shortage Reform and Patient Advocacy Act and the Nurse Staffing Standards for Patient Safety and Quality Care Act of 2015 are still pending. The Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act of 2019 and the Senate Bill 1357 by the same name have been introduced to Congress, but no action has been taken yet. National Nurses United provided a guideline of proposed RN to patient safe staffing ratios. So for example, the neonatal intensive care unit is suggested to be a 1-to-2 ratio, the operating room a 1-to-1, postpartum couplets 1-to-3, pediatrics 1-to-3, emergency room 1-to-3, and med-surg 1-to-4. The Georgia Nurses Association has provided recommendations for the state of Georgia. Nurses play a critical role in patient care, from monitoring patients for signs of clinical deterioration, assuring patient safety through detecting errors and missed care opportunities, and managing the system to assure patients receive high-quality care. The body of evidence is clear that nurses cannot fully play their role in patient care if their patient ratios and shift lengths are excessive. Currently, Georgia has no state statutes mandating safe staffing thresholds for nurses in any setting. A balanced approach to the development and implementation of unit-by-unit nurse staffing plans is needed to maximize patient safety and health outcomes. Okay, so quick quiz time. Which of the following is not one of the biggest issues facing nurses today? A, staffing, B, excessive downtime, C, bullying, or D, workplace violence? The correct answer is B. Excessive downtime is not one of the biggest issues facing nurses today. Short staffing in hospital settings is a top concern for nurses. A 2017 survey conducted by AMN Healthcare showed 72% of CNOs acknowledged moderate, significant, or severe nursing shortage in their healthcare organizations, and most believe the shortages would worsen over the next 5 years. A Medscape medical news poll conducted in December 2017 showed 71% of nurses said they had been harassed by a patient. A Government Accountability Office report published in March 2016 found healthcare workers in inpatient facilities such as hospitals experienced substantially higher estimated rates of non-fatal injuries compared to private sector workers overall. Hitting, kicking, and beating were the most common incidents reported. This slide has the results for the survey that we sent out to the class. Does poor staffing affect your work relationship? 80% of respondents said yes, 20% no. Are you or other professionals you collaborate with consistently short-staffed? 100% yes. Does culture overpower a poor staffing situation? 100% no. Do you feel supported by management? 20% yes, 40% no, and 40% sometimes. Do you feel supported by your peers? 100% yes. Do you feel like there are staffing issues at your workplace? 100% yes. Do you freestyle communicate or utilize formal communication? 40% both, 60% formal, 0% freestyle. Do you feel staffing affects your communication with others, such as your peers? 100% yes. What profession / what are you studying? We had 100% nursing as the response from our respondents. Challenges to staffing. Staffing, or the lack thereof, has a monumental impact on patients' quality of care. Healthcare staff shortages are an ongoing problem, especially in rural areas. Even a properly staffed hospital or clinic can face staffing challenges in a busy season, such as during influenza rise or the emergence of COVID-19. Add to this growth in the aging population, and providing exceptional patient-centered care can seem like a daunting task. There are also a high number of physicians, nurses, and other allied healthcare workers headed into retirement. A steady increase in the number of chronic diseases, and at the same time medical breakthroughs to treat those diseases, increase the demand for healthcare services. Qualified faculty members must have an MSN to teach at the undergraduate level. Most openings for nursing faculty are for doctoral candidates, and the enrollment in PhD nursing courses is low. Convincing a nurse to pursue a PhD is difficult, and nurses with an MSN or PhD can earn money in the healthcare setting more so than in the faculty setting. Multidisciplinary rounds have many benefits but do come with some barriers. Having adequate staffing with time and geographic constraints for the duration of the rounds may prevent them from being effective. Staffing affects quality of care. Hospitals with low staffing tend to have higher incidence of poor patient outcomes. Poor nurse staffing affects not only the patient, but the employees as well. Insufficient staffing increases nurse workload and job dissatisfaction, and it decreases total patient care overall. Job dissatisfaction is 4 times higher for nurses than the average rate for all U.S. workers, and 1 in 5 nurses report they intend to quit their job within a year. Inadequate nurse staffing leads to not only adverse patient outcomes, but increased nurse burnout. Short staffing can lead to patient harm like increased fall rates, pneumonia, and bed sores. Addressing pressure ulcers can save the average hospital about $500 million a year. Short staffing can also lead to more medication errors and staffing burnout. Greater nurse proportions initially increase operating costs of hospitals, but in the long run saves money through improved productivity, such as reduction in adverse events, decreased length of stay, and more efficient care processes. Several studies have shown that the increase in hiring of RNs does not significantly decrease a hospital's profits. Under the Affordable Care Act, hospitals with excessive readmission rates may not be reimbursed for up to 3% of their readmission cost. This penalty leads to huge loss in revenue. Properly staffed hospitals have a reduced readmission rate. Adequately staffed hospitals are associated with improved performance on quality measures like mortality, patient satisfaction, patient safety, staff satisfaction, and reduced burnout. Proper staffing allows for higher engagement between interdisciplinary team and the patients, which reduces the likelihood of improper discharge. Team-based staffing. When multidisciplinary rounds and team-based care are carried out successfully, it is noted to convey numerous benefits. Working in a team allows holistic care for the patient from multiple providers. This allows for more comprehensive care. Providers are more likely to identify areas of need or concerns for the patient and more effectively address those. The collaboration that follows increases understanding and trust between the disciplines and leads to higher job satisfaction for the providers. Each member feels important to the team. Tasks are better delegated, and everyone has a clearer understanding of what role they play in each patient's plan of care. This has been demonstrated in numerous studies. Multidisciplinary rounds streamline workflow and is more effective with time. It increases productivity, and because of the increase in communication and coordination, it reduces care errors and time wasted. Multidisciplinary rounds have led to a 50% decrease in-hospital mortality and a 10% decrease in length of stay. Patients have increased outcomes, and because of that, there has been an increase in patient satisfaction. With team-based healthcare and clearly communicated recommendations, patients and their family members spend less time waiting to see providers, discussing their needs, and going over the treatment plan. In this case, health communication is the singularly most important tool that healthcare providers have to allow them to provide the most outstanding quality of patient care. Staffing effects on communication vary in the inpatient setting and the outpatient setting. The characteristics can correlate interchangeably between the two of them, but some features are more prominent than others. For instance, in the inpatient setting, we see that staffing depends on the organizational structures as well as the organization's culture and availability of electronic records. If the organization structure is derived from primarily physicians, meaning that physicians themselves have obtained hospital ownership through shares, then it affects the attitude, morale, and cooperation of its staff if staffing levels are low. The number of full-time physicians available might be a constraint to deliver a good quality of patient care because low staffing affects physicians' time, commitment, and incentives to provide care at the bedside. In the outpatient setting, staffing affects communication primarily through management style. If management is not cooperating well with its employees, then we see that it affects staff satisfaction. In this case, it is not the staffing ratios affected, but mainly staff morale. When it comes to staffing ratios and levels, then it affects communication through not meeting patients' expectations. For example, midwives having to leave women in labor to attend home births outside of geographic areas. One thing in common for staffing effects on communication is that ineffective staffing can break down communication and precipitate misinformation and misconceptions among staff and patients. This creates dissatisfaction on both patients and staff and patient noncompliance. Effects of hospital-level factors on patient ratings of physician communication. Inadequate physician staffing affects patient satisfaction and also, more importantly, health outcomes. Physicians get overworked with higher workloads, and this threatens effective communication. It also compromises safety by ways of miscommunication and misinformation. The most significant factors were due to independent hospitalists and poor physician staffing. The hospital's teaching status, specialty status, and electronic record availability did not have any outstanding repercussion on physician communication. What does staffing mean for our patients and our own staff in terms of communication? For our patients, it leads to miscommunication and misinformation, which can lead to patient dissatisfaction. This is evidenced through patient experience in the HCAHPS score. For our staff, it leads to increased workload and compromise of our patient engagement. It also can affect the unit or organization's staff attitude and morale, which can affect future employment profiles. Here is an example of how staffing affects communication. Nurses use the teach-back method to provide patient education. If staffing is optimal, time constraints would be dissipated and nurse-patient engagement would be much more feasible. In here, we see that through applying the teach-back methods on nursing communication, it can positively affect patient experience. This is evidenced through the HCAHPS score. In this graph, we see that applying teach-back can positively affect nursing communication, as represented by the orange bars. Multiple handoffs that happen in the medical care process require advanced communication techniques. And it's important that we remember that the majority of communication is our body language, our attitude, and our tone, and a very small percentage of that is the actual words that we say. Team communication solutions. The ideal needs for successful teamwork include open communication, a non-punitive environment, clear direction, clear and known roles and tasks for team members, and for those team members to be qualified for their role, educated on their role, and informed of the importance of continued clear communication. In 2002, Kaiser Permanente created an easy-to-remember tool establishing a framework of communication between the hospital staff. This tool is called SBAR and stands for Situation, Background, Assessment, and Recommendation. It improves communication and has been shown to reduce errors. Crew Resource Management, or Cockpit Resource Management, is a set of training procedures for use in environments where human error can have devastating effects. Used primarily for improving aviation safety, CRM focuses on interpersonal communication, leadership, and decision-making in the cockpit of an airliner. Bringing the CRM model into the medical field allows for a customized design that absorbs errors. The use of redundancy, standardization, and checklists establishes a clear protocol. It allows for continuous learning through debriefing and dissection of events. Thank you all so much for your time and attention. We would like to present you with a call to action. Staffing is something that will contribute strongly to your overall satisfaction in your career. So what can you do right now? You can contact your representatives and senators and tell them how to vote when the time comes. Your Georgia senators are currently Kelly Loeffler and David Perdue. We have a runoff in January, so this might change to Jon Ossoff and Raphael Warnock. So just pay attention to the outcomes to know who to contact. And then as far as your Georgia representatives, we have 14 districts, so you just need to figure out what district you're in, and then you can contact your representative. And this list is who just won the current election, so these are all up to date. These are not going into runoff. And voting in January for the runoff for our senators to make your voices heard, you can obviously go to their websites, find out their thoughts. You can contact them and see what their thoughts are on staffing, and decide who best represents us and our needs as healthcare providers, and again, make your voices heard in January. Thank you so much.